So there are challenges with all three diversions. And with the Indiana pouch, I have pretty much had two challenges in the early on. I had stones in my pouch, most likely my surgeon thinks caused by having a period of time where I really struggled to empty. And when you don't empty, stones will form in your pouch. So I had those removed and they have not recurred, so that's great. My other biggest challenge is hernias. I've had two peristomal hernias, which is a hernia at the stoma. It's not uncommon at all. They have a very high recurrence rate. When you have a stoma, it's an opening, and physics just tells your intestine, oh, there's an opening, I want to come out. I was at higher risk than most people because I had two C-sections 30 years ago, and 30 years ago they sliced your abdominal wall up down, which they now know they shouldn't do. So between that and my weight being all in my abdomen, I have no strength, as my surgeon likes to tell me, in my core, and so I'm high risk for hernias. So those are the two that I've experienced the most of. Lydia, what have you experienced as challenges with your Neo?
Yeah, in the early days, I had a few. Within the first 2 months of surgery, I was diagnosed with acidosis, which is an imbalance of electrolytes, something that can occur with the internal diversion, and it's handled very easily with a tablet I take every day. And then shortly after that, a couple weeks, I did have a UTI, which was something I had to go to the hospital for and just be observed overnight, get some IV antibiotics. And then sometime after that, I did have a bowel obstruction. Again, back to the hospital overnight for observation, but it resolved on its own. And then sometime after that, I did have a kidney infection, which was painful. And it was caused by a stone that got stuck in the ureter, but it did pass. So I had a little drama, and it did require a couple visits back at the hospital, but they patched me up and sent me home. So.
And then, there are the things you need to be aware of that can happen to people. Urinary tract infections are common with the Indiana pouch. I've only had 2 in 4 years. So they can happen, they don't always happen. The other thing people are concerned with is leakage. You can leak from your pouch. I have had leakage a couple of times, but nothing unusual. Some people cover their stoma if they leak or drip a little. I do not. So leakage and UTIs are the two big ones people are concerned about. Stones is it happens, but not that much. And then hernias, and those are the big ones. And I think Lydia and I would both tell you that if you're looking at an IP or a Neo, you want a surgeon who does a lot of these. They are very complicated surgeries, and you want to interview the surgeon, know they do a lot, and ask about patient outcomes. And for the IP Indiana pouch, do their patients have urinary tract infections, and do their patients leak? So what are the other kind of issues that come up for people with the Neo?
So I know doctors will discuss with patients when they ask questions about what they can expect. They will tell them that it's possible that you will have to use a catheter and with the Neobladder, and that happens because sometimes people can't fully empty, and it is an issue that's more prevalent with women than with men. The men and women I know who do cath have talked about how fast it is and how they're in and out of the bathroom before anyone else. We have to find silver linings, right?
Mm-hmm.
UTI is an issue, and some people will become chronic with UTI, but usually they can resolve that with their urologic oncologist, or sometimes they're referred to infectious disease, which is doctors that can get more specific with treatment. And so as I mentioned before, I've had 2 UTIs. I had one early days within 2 months, and then I had one several years out. Those were the only occasions I had UTI. As far as leaking, that's another concern that people have. Most people will regain their daytime continence pretty early on. A lot of people, I say a lot, I've been told it's like 50-50, will have leaking at night. And again, to a different degree, could be a lot, could be a little. I have been fully continent for many years, and then more recently we'll find that I will occasionally leak at night, and so I will wear a pad at night just in case. And so those are some of the challenges. There's some other challenges with the gut, with digestion, because our gut has been cut and reattached, and so some people will have some issues, and for most people it resolves. For some, like myself, my gut was challenged, and so I do take a medicine that I will always take, and that's fine. It takes care of the problem, so it becomes a non-problem.
And like we said, there are challenges with all three diversions, and they're less than the challenges of living with cancer.